I wanted to start by saying something about the Berkeley Dog and Cat Hospital, just really briefly. It originally started as a livery stable. We can date it back at least as far as 1878, and it would have been where the working horses of Berkeley got shoed and got their medical treatment from the shoe guy, you know, right? It was a livery stable. We don't know the name of the place back then, but by 1907, it got the name the Berkeley Dog and Cat Hospital, which is kind of amazing, 1907. And as early as the 1960s, the hospital was seeing exotic pets. I kind of love the full circle that it used to be a horse care place, and now we're floating teeth and treating gut problems again in our rabbits. So, where is your nearest overnight vet? I actually want an answer to that. So, how many of you guys have to go pretty far before you're going to find an overnight vet for rabbits? Yeah, give me some minutes or about an hour, right? An hour, okay. So, and that gets a little tough when your vet closes at 6, 7, or 8 p.m. Our hospital is a 24-hour hospital, but not every one of our overnight emergency doctors is comfortable with rabbits. Some of them are. And so you basically are hoping for something to do, if you can kind of assess what the situation is, before you can hop in the car and get that shelter bunny, or maybe you've been called by someone who's adopted one of your rabbits, to the vet, right? And hopefully you aren't in Saco, Montana, where apparently the nearest vet is 3 hours away, or at least according to Google Maps. So this bunny apparently likes to make an appearance in today's lectures. But I have to make a few comments about state law and ethics, because it affects us when we are trying to help you in ways that many of you understand, but maybe may not always be obvious. So there are questions about what I can legally advise. Every state has different laws, and in many states, I would not be able to prescribe medication unless I had literally seen that pet before. Okay, that's very common state to state. We need to consider the ethics of what we're advising, because perhaps what's going on your end isn't obvious, and it may sound like one thing's going on. I suggest something. I don't want it to be harmful, right? We always, though, want to try and get you through that awkward period until you can get to a vet who treats rabbits. So I'm going to talk a little bit about what was addressed somewhat before, but in a little bit of a different fashion, and then it has to do with the veterinarian client-patient relationship. And with you guys, you are our clients too, right? Because we're helping you take care of the rabbits you're caring for. So for example, let's say this rat is Rabbit Redford, right? And Rabbit Redford maybe had a previous home that wasn't so good, lived on concrete, in his own urine, and he has horrible foot sores. And so maybe I'm seeing him and his caregiver, whoever that is, maybe multiple times a week for a while, right? I'm gonna get to know that client, and it might be you, and Rabbit Redford and all of his health issues pretty darn well, which makes it easier for us to have that conversation on the phone, right? When maybe you can't get in right away. So I know a lot about you guys. All right, this is Lady Helen von Rabbitbutt, right? And she's a little prone to respiratory infections. She maybe has come in 6 times in the last year because she's just a little sensitive, right? And so I know that caregiver and this bunny pretty well, but I don't know the other rabbits in the household that well. So I don't know their medical issues. Ralph the rabbit, okay, he comes in twice a year for his well checkups. He's just a healthy rabbit, right? And so I know this is an owner pretty well, but not super well. I don't know all their skill sets and what they know how to do at home. And I don't have a clue who this is, right? So I don't know the caregiver, I don't know the bunny, You know, I don't know what the background is, so it makes it a little harder. I can still probably make some recommendations over the phone until they can get in the next morning to see me. Say, I'm gonna be leaving in an hour and they can't possibly get there that fast. And believe me, I stay late sometimes, as a lot of exotics vets do. But I'm gonna be a little more limited in what I can do. Now, to kind of come back to where you guys are in this veterinarian, and let's just say client relationship. So Ann Martin and I know each other pretty well, right? We email, we call, we text. I've got a very good handle on what her skill set is and what she knows and what she's not going to try to do just to see if it works, right? Whereas there may be some other rescue groups that I just don't know, you know, what they know and how comfortable they are with treatments and so forth. So changes the, you know, the dynamic and what I feel is safe, right? Okay, a caveat to everything I'm going to say going forward. Every vet has his or her own approach to treatments, right? We all have different things we're comfortable with. I've had this little frog in my throat ever since the smoke fires came, so I'll do a little bit of throat clearing. I may use drugs that your vet is not comfortable with. They may use drugs I'm not comfortable with, and it's not that it's wrong, it's just what we've gotten used to, our cocktails, if you will, for certain situations. And so I may bring up stuff that your vet wouldn't want you doing. The research is always improving. Fortunately, we go to these exotics conferences, the exotics vets, and there's always something new. Actually, I have to mention this. I was at a conference 2 years ago where the moderator to all these veterinarians in the room who were all there to talk about exotics, all the dog and cat people, were in another room. And he would multiple times through the course of the day say, so I just want to say to all you exotics vets out there in the room, if you're doing it the way we told you to do it 6 months ago, it's probably wrong. So that is just changing so fast for us, you know, we're all trying to keep up. So it's a moving target. We're trying to keep up with the latest knowledge. We try to stick to scientific studies, but as a lot of you guys know, sometimes we have to go with some anecdotal evidence because the studies may not be out there yet. Hopefully, as long as we're not doing harm, we're okay. And each of these bunnies is different. They're all going to respond to different drugs differently, just like if I take a Benadryl, it does absolutely nothing for me. It will not help my allergies. If my sister takes a Benadryl, she will drive her car into a tree. So they're all different, just like us. All right, what are our most common emergencies? We're back to some audience participation. Name me a common rabbit, oh crud situation. Did I hear stasis? Let's just put that as the top 3, right? Some days I feel like, and I see birds and reptiles, and I feel like sometimes this is all I'm seeing, right? So, oops, I jumped ahead, but injuries, obviously, a leg caught in a cage bar, one rabbit bites another. What else do you guys see where you feel like, oh, it might not be able to wait? Obstruction, okay, so obstruction or bloat, which I'll kind of put in with, although stasis is a little more specific, but any of our gut problems, sure, but obstruction, bloat, and what was back there? Upper respiratory? Yeah, I mean, some of these respiratory things are really scary, once the bunny is neck extending and nostril flaring, and, ooh, we're gonna make it. That's tough, because it's a lot harder for me to know what to tell you if you don't have an oxygen cage and a really good sedation drug on hand, right? Those are tricky, I really want you to be able to try to get to a medical facility for those respiratory situations, but absolutely. Anything else that I've looked at? Lethargy, yeah. Any kind of lethargy is starting to get really concerned. Choking on food, yeah, right. The rabbit Heimlich maneuver, yeah, right. Okay, so, Poisoning, right. Head tilt and rolling, right. Those are really scary, you know? And you just want to try and keep those animals from hurting themselves. I'm not going to be able to cover everything, but I'll hit on some of the biggies, okay? So what can you do until you can get to the vet? Well, it helps if you have an idea of a few fundamentals. Some of these conditions can really muck up the bunny's belly. And I realize that for a lot of you, taking a temperature might be extremely basic and simple, but I gotta tell you, I have an awful lot of longtime bunny owners, bunny foster owners, who don't know how to take a temperature. So I figured this is a great excuse to get into a little bit of, you know, dirty pictures. But in terms of normal temperature, you're going to see there's different ranges published. I generally go with 100 to 103.5, but you know, different universities with exotics departments have this slightly shifted a little bit. I don't think anybody's going under 100 and saying it's okay. So a bunny under 100 is going to worry me. So, you know, the first thing for someone who hasn't taken, and again, you guys are out there teaching your foster care people, right? So, you know, kind of giving them some of these tips, you're training, right? So the first thing is you look here and wear the parts. It's all fur, but, okay, sometimes they give you a hint. Here, go here. But probably not if they have stasis or bloat or an obstruction, right? So, so here's our little, whoa, okay. I'm just using the thermometer to sort of start to get things out of the way and say, where are we? Okay, it's a little girl, and I'm not gonna go in the girl part. They hate it when you put it in the girl or boy part. Really hate it. And then I have this little sort of down up thing. So this bunny's, you can't tell, but the bunny's being supported really well in the hips and the back by the technician, you know, the standard pose. And then this technique where the bunny's burritoed, and you can actually do this version alone by leaning over the rabbit after it's burritoed. And I'm kind of tickling things, and there's the little rectum winking at me. And so, well, okay, I'm in the right place. And you probably couldn't tell, but that was a little boy. His penis was full of. One comment about digital thermometers. Some brands seem to tick off, like turn off, early, like before they're really done. And you can get an inaccurate temperature. So I will often, now that I know like the 3 brands that are kicking around our hospital, I know which ones kind of tend to turn off too soon. I'll get that in there, I'll take a temperature, I'll turn it off, I'll leave it in, and turn it back on again and let it do one more run. And it's probably going to be a little higher than when I left off, which either is going to be, oh wow, this rabbit does have a fever, or, oh, okay, this rabbit is not 98. 100.2, okay. So just a little tip about some of these thermometers. You guys notice this? So ways that we warm our rabbit patients in the hospital, we usually have some IV fluid bags kicking around, and they have "warm me" written on them real big, so no one uses them for IV fluids, and they get heated over and over again in the microwave. Of course, you have to be careful because you can make them too hot, but they always get wrapped in a towel so that the rabbit can't possibly be burned by it. But for general consumers and pet bunny owners, hot water bottles from the pharmacy could work great. Again, you don't want them chewing that, so being wrapped in a towel really covers that base. The fire, smoke. And then what I wouldn't want you to use is electric blankets. There was a case near us where it was a dog spay-neuter clinic, and they were using these to recover the dogs. And several of the dogs got 2nd and 3rd degree burns because they couldn't move. They were still asleep, waking up from the procedure. They'll say on them for people, don't sleep on these because you'll burn yourself. To say nothing of the fact that it's an electrical cord, right? A little too tempting for any rabbit. And that's when it's working properly and not when they've malfunctioned, right? So I never recommend electric blankets. And then you've got your hot bunny, right? And they have these great radiators called ears. This is not a cure, it's just to try to get really high fevers down. It can only go so far, but it's something you can do. And that is to wet some cotton balls with alcohol and rub them on those ears. And you can do little footies too. Might bring the temperature down just a little bit, okay? Obviously, syringe feeding. I'm gonna say critical care because that's what I've used for years. And one thing even, I've had technicians who have worked at other exotic practices come to me and say, oh yeah, I know how to syringe feed. And they stick the syringe in their mouth and they just keep pushing and pushing. No, right? So in instructing, people are learning how to do this. Syringe goes in the mouth, you put a little bit in, you take it out, it's the rabbit chewing, right? Okay, really fundamental for a lot of you guys. But we think that the fiber from getting anything like a critical care in is what can help get stopped guts going. So if the bunny's willing to chew and swallow, this bunny happened to be post-operative dental work and she's chewing away. She's like, this is great. But she has to be doing that chewing and not letting it collect. And then I think when I first started, I didn't really believe in abdominal massages. I didn't know that they did that much. But I've kind of become a believer. Obviously, I'm doing a lot of things all in combination, but again, something that can be done at home. We teach all the technicians at the hospital clockwise, be able to feel the guts kind of moving through. Obviously, if you have a rabbit with a really bad gas float, you don't want to be pressing too hard, right? Things might be really fragile in there. But we've sometimes just felt like this was a thing that finally got them over the hump. So it seems really simple, but I'm a believer. A little something on hydration generally, and this came up before, like the little Lixit bottles. That just seems like a cruel way to make a rabbit work for water. But among veterinarians seeing rabbits, I think a lot of us, many of us, believe that a lot of pet rabbits are living borderline dehydrated, right? And they're just not taking in enough water during the day. And that can sometimes be the thing that tips the scales just enough to put them into gastrointestinal stasis. And that maybe some of these rabbits would never get there and tip the scales if they were just taking in enough water. So, obviously the water bowl, maybe have a water bottle too, because it's something to play with. I'm a fan of multiple water bowls and multiple water bottles, whatever it takes to get them to take in more. But say you have a bunny who's starting to go off their food a little bit, but they're still eating some, you can wet the heck out of those veggies, just serve them like super wet, take in a little more water, that may help. And moistened pellets. Again, some of these are kind of fundamental, but sometimes I'm talking to someone who I think would know, might have come across this and they have it. And then of course the image is about giving injections of fluids. I can't show you a video how to give an injection of fluids and then you go home and do it, right? So I'm curious, how many people in the room do injections of subcutaneous fluids? Yeah, wow, that's awesome. And for the people who didn't raise their hand, like, cool, get someone to show you how to do it, right? But you want to know what the correct volume is for that size rabbit. You don't want to give too much fluids for a couple of reasons. One is the body can only take so much before we get what's called fluid overload. But you may have a rabbit that you don't realize has heart disease. And if it has heart disease, it can't pump all those fluids around. We have to give a lot lower dose. So hopefully we've already established the bunny probably has a good heart, but we may not know that. We have to be very careful. And in this image, which is a little washed out on this screen, but at the bottom, so we got our different types of fluids. I like the one I like, other people like something else. The fluid line, and then, or for smaller bunnies using a syringe, and we call butterflies, needles with a little cord on them, because then you can get much more accurate amounts of fluids to little bunnies. These bags have 50 milliliter mark lines. That's incredibly difficult to get that accurate, right? You know, you're going to be off, and you could be off by way too much. It would happen to me if I tried to get a perfect 50 mils into a rabbit. So a lot of our emergencies were worried about pain, and we know that pain can just get them into worse problems. Maybe the pain was something else, and now we have a GI stasis because of the pain. And a lot of folks have Medicam. The generic name is meloxicam, and I have the brand name box up here, which a lot of you may be familiar with. And I also have a bottle of generic that we got from our compounding pharmacy. I was blown away by how cheap the stuff was from the compounding pharmacy. If you want to save money on a non-steroidal anti-inflammatory that you're using all the time, and you aren't already, check with your compounding pharmacy, because my clients are thrilled that they're getting the savings. We happen to get it in a different concentration than the commercial stuff. We're getting it in a 3 milligram per milliliter dosing instead of 1.5, which just means there's less volume to give for each dose. You don't have to put so much in the syringe. They tend to like it anyway. Our pharmacy technician is a complete flavoring nerd, and so she calls the compounding pharmacies and goes, okay, for this, I want grape. And I'm like, sounds good to me. So, and the rabbits seem to like it. I'm going to mention Gabapentin. Are you guys seeing Gabapentin around for the rabbits? Some of you? Yeah. So I definitely use this drug. It just may not be, we don't have enough research in rabbits, but it just may not be a drug that's going to give you that quick fix, the quick response for pain. Generally, a lot of animals, and you need to use it for a while before it starts working. And maybe it's a number of days, but for that, oh my God, tonight I need something, I'm not sure how far that's going to get you, although I do love using it in combination with other pain medications. All right, so I won't make you raise your hands on this, but some people may have some controlled substances still kicking around on the shelf from some other bunny, and so this is a little tricky, the ethics of having controlled substances kicking around, and how are they being stored, and can anyone else get to them? Does it work? There have been good studies in cats. Buprenorphine or Buprenax, which is an opioid, is absorbed in the mucous membranes in the cat's mouth. I'm not talking about swallowing, I'm talking about in the tissues. And it's an effective pain medication. It was designed for injection, but it works really well in cats when it's absorbed in the mouth. They go and do studies in the dogs and they go, oh, it doesn't work in dogs. They really don't get good pain management from it. So what about rabbits? Now I know there are a couple of vets here. I haven't seen any good studies in rabbits in terms of absorption in mucous membranes being absorbed in the mouth. The point being, we don't know for sure how well it's working when we give it that way. We use it certainly by injection, I don't use it alone because I'm not sure how much it's doing, but if you are giving it, don't mix it in critical care and give it, or put it on some food and give it, because then it's swallowed and it's doing nothing, for sure, okay? So, Tramadol, which is a drug we know when swallowed can be effective as a pain medication. It just tastes awful, right? Have you guys used this? Yeah. The rabbits are like, are you actually trying to put me over the edge and kill me? It tastes awful. I wish there were a way we could really cover up that flavor. Birds and reptiles that take it, they just can't taste the bad. But every mammal knows this stuff tastes like. So unfortunately, I just don't try to use it in the bunnies because I think they hate it so much. We need more options for oral pain medications. You know, there's just not quite enough out there for us when we want to combine something with meloxicam. Yeah?
What are your thoughts on transdermal tramadol?
Okay, transdermal tramadol. I haven't used it yet. My concern with transdermals always is how much are they absorbing? And that's going to vary a lot based on their temperature or physiology. We have the same issue, you know, back when I was still working with cats, you know, trying to do transdermal on the ear medications, and the absorption in some of these drugs was just wildly all over the place. So I didn't really know how much they're getting. It's a great question, and you know, as I say, I haven't tried using it. You guys using it? Yeah, and you like it?
so.
Okay, they think they like transdermal
It's really easy to apply.
Tramadol, and it's really easy to apply. So again, I think this is where we just need more information. We need more options, you know. There's some days that are like, I just need one more drug for this rabbit before I send him home. It's hard. All right, gut stuff. We're kind of back to the, you know, anything having to do with the gut not being happy. Most people know about metoclopramide and cisapride. I will tell you, I have vet colleagues who I think are fabulous rabbit vets, and they don't use these at all. I use them. Everything's sort of a cocktail, you know, I'm mixing things. I don't know which thing is doing the most, you know. Maybe it's everything, you know, that's working together nicely. But I was just at UC Davis last week teaching about rabbits to first year students. And the vets there saying, yeah, we used to use those drugs. We don't use them anymore. We feel like syringe feeding critical care, that the fibers, that makes all the difference in hydration and pain management. They said that we don't even use that anymore. And I have other colleagues that absolutely swear by these drugs, or only swear by one and not the other, you know, or it's always both. And so I do use them, and I think they help, but I'm never using them alone. So who knows what's making all the difference. I feel like sucralfate or carafate may be underused in gut situations. The gut's probably inflamed, it's irritated, we don't want to rupture. And this is something that if you guys have it and you know what the dose should be, might just be that little extra bit of protection to keep the gut from really getting away from you. And the only little bit on that, the asterisk, is you don't want to give it the same time or before other medications, because then your other medications won't be absorbed. So this thing is lining the gut like a wall, and you give another medication after that, it's just going to go through the system. Yeah? No, lactulose is a different drug. Great question. Lactulose we'll often use as a stool softener for rabbits that are having very firm stools. We'll talk a little later about a patient I had with megacecum, where we'd use that because she was just getting these big hard poops in her cecum. But, and sucralfate, carafate is brand name. That's a human product, and it comes commercially. That's the one down below. In a concentration that's very manageable, working with bunnies. Just going back to metoclopramide and cisapride, I do want to mention we don't want to use gut motility drugs if we think there's an obstruction. And we may not know that for sure without an x-ray, but maybe you have a repeat offender, as I call them, that you know this is an obstruction. You didn't need the plastic bag next to the cage. And you didn't, you're fairly confident that it might be okay to go ahead and use them. But we have to be careful, because if they're obstructed, things can't move, and you're forcing that gut motility, forcing the gut to squeeze, then you might end up with a rupture, and that's kind of game over. So I know that at least half the people at my table over there don't believe in simethicone. I have colleagues, vet colleagues that don't believe in simethicone, and I have vet colleagues who swear by my simethicone. So I'm talking about Gas-X. I use infant Gas-X. And, again, I'm using it in combination with multiple things. Call it a gas buster, so they've got all this gas, and can we kind of break it up or try to deal with a little bit of a gas bloat by breaking down those huge bubbles. And no one's right or wrong. We're all just trying to figure it out. So, when one of my vet colleagues says, I never use it, it doesn't work. I'm like, you might be right, and it's probably, I'm guessing, it's 50-50 split among the veterinarians, but that's just a guess. So, yeah, the caveat at the early on, everybody's doing different things. So, your best weapon is a relationship with your vet. I got to go to Pixar, it was fun. Obviously, don't have to tell you guys this, but you guys see a vet who sees a lot of rabbits. Talk in advance about possible emergencies. Talk to us. Ask us, very specific questions, as specific as you can get, when maybe you don't have that particular bunny on the table with us. develop a relationship, check in with questions. I have clients who email me all the time. Some of my colleagues at my practice don't do email. They just don't want to cross that barrier. I like it. It helps me stay in contact in a way I can control. And if you have a special needs bunny, again, I use the term repeat offender, you can make a what if plan, in advance. So you actually have drug doses, that would be okay. So I can give you an example. This is Lola, larger than, actually she's kind of like this. She's got that personality, larger than life. Okay, Lola K, we diagnosed her with megacecum maybe about a year ago. And this is an owned bunny, and I know some house rabbit societies have the funds to do a lot of workup, some don't. Some other rescue groups here that aren't house rabbit, whatever. But in this case, we knew a lot about what her condition was, including hard kidneys and her liver and everything was. We got her started on a medical plan to help her kind of deal with her megacecums. Her cecum's distended. It's like a big bag of, it's supposed to be this amazing supercomputer that's sorting poops. It's going, nope, this round we're just making cecal pellets. Okay, this round, supercomputer, and now we're regular poops, vitamin B, all this crazy stuff going on, and hers is just not working right. So we ended up with a plan that was really helping her out a lot, and sort of adjusted as we went. So, okay, I have a lot of contact with this owner, okay, so I know her really well. And she would occasionally have episodes that were emergencies. So mom says, okay, what can I do like the next time? I thought this is great, this is excellent. So Dr. Sif emails her a list of all the meds that Lola is currently taking. Okay, as far as I know, now I could get an email back on, oh no, Dr. Sif, I wasn't doing that much. Well, at least I spelled it all out and she can tell me if that's not what she's doing. Clearly listing the doses of each and the concentration of each drug, because a lot of these drugs come in different concentrations, so I want to make sure she and I were on the same page. And then lower part of the email, I say, and you could increase this one to this dose for, until you're over the crisis. You can, this dose until you're over the crisis, or until you can get in to see me. You can up the fluids by this much temporarily, then go back. And she loved this. This was great. She felt empowered to control the situation. And you guys probably have foster rabbits out there that like this. You're like, oh, waiting for the next crisis, right? So, and it's all in an email, which then goes into her permanent medical record. Mom has a hard copy that you can refer to. I've got my copy. Oh, crud, what did I say to her? It's all there. So how about, not what's going to help you right this second, but telemedicine is a big topic. It is turning up in our veterinary journals. There's discussions about how this is going to affect our profession and our clients and patients. And it's getting into every medical field, so us too. There are regulatory and legal issues that are being talked about. I practice in California. What if there's a client in Missouri and they need help and okay, I don't have a license in Missouri. Is that okay? Am I really their doctor? So that's being discussed, and believe me, veterinarians are very interested in where this is going. It may really change what we can do to help everybody, particularly as they work out all the kinks. Think about these people that are really in remote areas. Are any of you guys actually in remote areas of the country where it's really far to get? I think a lot of the folks here are more closer to cities, but are you?
We have a member in Alaska.
Okay, they have a member in Alaska. So, yeah. There are people who have beloved rabbits that just are really far away from help. And my hope is that as we work out how telemedicine is going to work, that we're going to be able to provide more care. But nothing is going to completely replace hands-on examinations and proper diagnosis. So this rabbit is getting hands-on. Yes, you're definitely cute. We have established that as part of your physical exam. And the other good news is okay, I got a little bit of exotics training when I was in vet school. I know there was a comment about how your vet school's got like nothing, the local vet school's got nothing, right? But it's definitely getting much better, much better. More and more vet schools are under pressure or have staff that are highly motivated to provide good training. This happens to be at UC Davis, probably a month ago. These are all first-year students. They have 2 labs. The first one, this one, is all how to pick up the bunny safely. 3 different ways to pick up the bunny safely: how to take it out of a carrier, how to put it back in a carrier, so it's not stressed. How can you tell if it is stressed? Watch it. Look and see how fast it's breathing. I mean, they're really doing this. This is good. Ignore the fact that the cages in the back have wire bottoms. But, and you know, this is a small part of the big first year class. So they have this first one, they have another one like a few weeks later where they are taking heart rates and respiratory rates and so forth. And then their third year, they review everything, the handling, the sort of looking at them to see what their respiratory rate is before they pick them up and before they stress them out. You'll be glad to know all the rabbits are a little sedated, so they're all like kind of loosey-goosey and they're not super stressed out by this. And the third year students they're learning how to really do an exam and do diagnostics. So it is getting better. Not every vet school's doing this, obviously, but we're going to have more money vets out there. That's what you guys really need. Yay! So there's Scout and Scout's End sticking out. And I am going to do this, but first I have to insert here that it was 1989 when I got my first money from House Rabbit Society, which at the time was in Oakland, right? And at the time, vet school was not even a twinkle in my eye, and here I have come full circle working with the House Rabbit Society that I got my first money from, so I kind of love that. All right, so what I know, there's so much that I can't tell you, like I actually, so you guys know some of the medical expressions, like BID is twice a day. So I've instituted a new drug in our hospital for those really, really hard cases where you're like, I just need something to fix it. And so I have something called MFD that we give BID, and that's magic fairy dust. So you just fix everything, you know? So it's short of giving you MFD that you can give twice daily. You know, trying to give you some things to work with, or at least then pass on and train to your foster homes. So, what questions can I try to cover?
Telemedicine, I'm not sure. Exactly what is that?
I'm sorry. Okay, telemedicine. In the hospital system that I go to, Kaiser Permanente, I can contact my doctor and I could have a phone conversation with them, or we can literally both be on our laptops and I can go, this thing right here, and she can look at it and go, oh yeah, you know, I know what that is. Or she go, you know what, we need to have you come in. All right, so it's using the video on your computers to actually have a face-to-face, as it were, with the doctor. And so, thanks for asking that I clarify that. It can mean different things because there's forms of telemedicine like, I'm going to wear a heart monitor and then I'm going to download all of that into a computer, and now my doctor can look at my horrible arrhythmias that I've been having overnight. No, not really, not me. But, so it's where we can start using the computer and video and data that we can send through the computer to send right to the doctor. So in theory, could be plopping the bunny in front of the video screen or having a conversation with video so that the vet is seeing more, although it's not the same as feeling the belly or whatever. Is that, okay, yeah. But the thing with people is happening. I mean, I really can just contact my doctor and say, I need a video appointment. Yeah.
A lot of us will have Medicam and things like that at home. What kind of liability are we potentially faced with? We have a member who says, I can't get a hold of my vet. What can I do? I have a buddy in stasis, and everybody's going, well, give the dose of Medicam. Or some people have shared Medicam that they've had at home for their buddies. They keep extra and they provide it to another member.
Okay.
Yeah.
Right. So the question is, a member, which I guess would be like a volunteer for your chapter, something like that, right?
Or just a general person who's a member of a group who says, I have an emergency.
Okay. So someone contacts them, they say, I have an emergency and I think my rabbit has stasis and I have some meloxicam. And what are the kind of, what was the term? Liability issue around that. So, right, okay, it's not a controlled substance, so we don't have that legal issue. I think it's a tough call. I mean, I think a lot of rescue groups find themselves needing to just start Medicam, and they have it, and they know how to calculate the dose, the milligram per kilogram dose, whatever your vet milligram per kilogram dose is, which might be a little different than mine, right? But I feel like for a lot of this crowd, it's going to be necessary, but you don't want people using it willy-nilly because they can do harm. You use too much, or if the rabbit's dehydrated, any animal is dehydrated and goes and takes meloxicam, there is some risk to organs. So, we want some assurance that they're not really badly dehydrated, and we just put them on meloxicam. Will one dose tip them over the edge? Probably not, So if it's, gotta do something before we get to the vet in the morning, it's probably okay to give a dose, but I agree, it's sort of the problem here when I was asked to give this talk. It was really interesting. I was given the subject matter, and I went, what if I talk about this other thing? And they went, no, we want this. And I went, it's going to be hard. And I actually really fell in love with the talk as I got further and further into kind of deciding how I wanted to approach it. But these are the challenges. What's okay to just give without the vet saying, yeah, give it. Yeah. It's tricky. This is where I can't give you an absolute. Yeah.
It's been my understanding that if we charge for what we do like that we're practicing medicine without a license, in which case we could be held liable. But if it's somebody that understands, I'm not a vet and I gave you this, often it's subcutaneous fluids or something of that sort. It's my understanding that if they understand that I'm not a vet and I'm sharing something I have for my rabbits with them and they agree to it, that there's no liability
Right.
involved.
So what she's saying is her understanding is if someone's providing some medication to help out, but not charging for it, then they aren't really practicing medicine without a license, and that the liability issue is not so much an issue. And yeah, I agree. I mean, if you were charging for it, that's a big problem. Right? But you can also hear stories about, someone who decided to do surgery, right? They didn't charge anything for it. They did surgery on something, right? And they didn't have a license. And so it gets into some terrible gray areas because our surgery example is really obvious. Letting someone have a little bit of your spare Medicam, meloxicam, it's certainly not surgery. So there's some continuum after which we can probably get away with some stuff without having a huge liability issue. You also don't want it to come back on. You said it was okay. I gave the fluids. Turns out I don't know how to give fluids. I gave it in the eyeball. Well, all right. So this is where it goes back to, what do people know how to do, right? But yeah, absolutely. Yeah.
What happens with our vet we have established a relationship with, our rescue? Our vet, because in Georgia, now we're from Georgia, allows us to work under him, which makes it legal if we text, email, or call him.
Right, okay, so what she's saying is they have a relationship with their vet where as they have fluids, they have meloxicam, and as long as they text that doctor that they have a relationship with, then there's sort of this understanding that it's official, it's official. The doctor knows, and they have the stuff, and that it's okay if then they treat until they can get into office hours. So I think that's, again, that's the, have a great relationship with your vet where you have an understanding. And I think that's huge, so that's like perfect, yeah.
Just kind of a caveat on that, is that when the person who has the emergency is also a patient of that veterinarian?
Well, not necessarily, no. Only until they have to agree that they'll come and see him, of course. Now, we don't have a guarantee he knows that, but that's the deal. We always say we're not the vets, we're looking at our doctor, that's our vet. He will allow us to do this under his license if you agree to see him whenever the next office hours. And if they say no, we don't do it. But they always, I mean, it's like the rabbit, and in many cases we save that rabbit's life, many cases, just by buying that time and keep them out of emergency care. Our vet does not like that's not the things to emergency care. You don't have to rate rabbit and say that's in emergency care. It's a crapshoot. So he would rather us treat him than the emergency care. So that's how that works out for us.
Okay, yeah, so it's sort of what we were talking about before, but sort of a clarification that if they're offering to treat until the person can get to the vet, say the next morning, that person has agreed they are going to the vet, and they just don't have good emergency care anywhere in the region, apparently, so it'd be really tough to find someone overnight. Yeah.
Judging by all the people that raised their hand earlier about giving subacute fluids, I might just be asking this question for myself, but potentially they may have volunteers that this might apply to. But one of these days, I'm going to encounter a situation where I'm going to need to give subacute fluids to my money. I have this thing about needles, and maybe other people have things about coon care or something like that. Do you have any advice to kind of help get over that, or what to work on? I'm sure that students too that may have.
Yeah, sure. Okay, so the topic is squeamishness, and how do we get over needle phobias, or that's a really creepy wound, or right. So absolutely, and I certainly have plenty of clients. I try to prepare my introductory remarks about giving an injection, whether it's fluids or some other form of injection that the owner has to learn how to do, so that I break it to them easy and slowly. And I start with, you can do this. I really I give them a big pep talk. You can do this, granted, I've had, huge guys with a leather jacket and the sunglasses are hanging here, and they get one look at the needle and they're like, all right, so it's going to happen. But what I say is, what? Really, I have a lot of clients who are squeamish about needles, and they do it. They get over it. I sort of get them into that club of people who are squeamish about needles and say, and you're going to be one of those people. You are going to overcome. And I give them the full pep talk, and then we get all this stuff out and we talk piece by piece through it. Every little step, and we we show, and then we make sure that they can do it. And I think they're all prepared for the rabbit to absolutely fly off the table in some kind of painful panic attack, and the rabbit's like, it's a needle. I've dealt with worse. I had GI stasis 2 weeks ago. I can take it. So I think when you can find someone who can kind of just talk you through it really carefully, you just feel supported. I think I've had clients where they did see a vet who said, this is how you do it, and then sent them out the door, and I thought, or just gave them a bag of critical care and a syringe and sent them out the door. I'm not okay, no. They need a demo. We demo everything. We demo how to pull the drug out of the bottle. Everything. Look, there's a bubble. See the bubble in the syringe? We're going to get rid of that. We demo everything. And so I think if they have a really good demo, then, and I say, and you know what, the first few times are going to be, not go well, and that's okay, and we just try to build them up. So you can do it. All right. Any of you who have not done subcu fluids, it's time. Yeah.
Just one thing I would suggest is that if you do it on a rescue bunny rather than his own the first time.
Oh yeah, doing it on a rescue bunny first, and then you can torture your own rabbit. That was a suggestion. So I better only take one more, and I'm going to do someone like, all right, this is where I can actually put my glasses on. So I'm going to go with the gentleman in the black t-shirt. Yeah, that's you, yeah. Because then I know I'm running out of time.
I know this may be obvious, if a rabbit's dehydrated for a long time, you can tell, it's skin. How about a short term? How do you determine short term dehydration?
Right, how do you determine short-term dehydration? It can be hard. In cats, we tent up the skin, and if they're even somewhat dehydrated, the skin over the shoulder blades will kind of go back into place a little slowly. And if they're very dehydrated, it doesn't go back. And in rabbits, they have just enough subcutaneous fat, so fat under the skin, that it's not always as obvious. We still do that, and they get dehydrated enough to go, oh, yep, the skin's not sort of popping into place super fast. So it's called tenting the skin, and you're just grabbing that skin over the shoulders and then letting it go slowly and see what it does. But it can be hard, and I think you have to base it on history. A lot of the time I have to base it on, what the owner or foster caregiver is telling me to say, sounds like we may be dehydrated. I figure once they're not eating well, they're also not drinking well. So if they stopped eating well like 24 hours ago, we're probably dehydrated too. It's rare that I have a client come in and go, and my rabbit's just drinking so much. I'm like, it happens, but. All right, if anybody has any questions later, I might stick around for a while, but thank you very much. Appreciate it.